Hi guys, still on the Rcgp case cards. This one says, explain an exercise tolerance test to a patient on atenolol who has no contraindications. We are worried that you might have angina, which is like cramp of your heart muscle. Even though the heart tracing ECG you've had done here is normal, we cannot be absolutely sure you don't have angina without conducting further tests. The exercise tolerance test is designed to measure your ECG while you are exercising, and your heart is being pushed a bit harder than when you are at rest. First of all, you will have an ECG and blood pressure check at rest. You will then keep all the monitoring wires on while you start to exercise on a treadmill. An ECG will be recorded and your blood pressure monitored every minute or two while you are exercising. During the test, the speed and incline of the treadmill will change to make it harder for you. But don't worry, the operator will stop it if you get too tired or short of breath. And all treadmills have an emergency stop for you to use if you need to. It will usually last around 12 minutes, but you can sometimes go on for up to 20. You will need to stop your atenolol the day before your test, but you should restart it afterwards. We are hoping the results will show you don't have angina. But if there is any doubt, the heart doctors, cardiologists, may recommend further tests. So if you look at the last statement, we are hoping your results show that you don't have angina. So it's usually good to give optimism and hope that actually things come out normal, but then explain that if things confirm otherwise or suggest otherwise, you may need to do further tests or you may need to initiate certain treatments. The next case card says, discuss a celiac disease blood test with a 26-year-old woman who describes suggestive symptoms and whose aunt has the disease, celiac disease. The symptoms you've described, bloating, diarrhea, tummy ache, and wind, could be due to celiac disease. But there are other things we should consider too. In case you're not sure, celiac disease is simply a sensitivity to gluten, which is found in wheat, barley, rye, and any foods containing them. The body thinks the gluten is harmful, and the immune system fights it as it would fight a bug or a virus. This immune response damages the lining of your gut, making it angry and inflamed, so that it doesn't work as well as it should. I can understand your concern about celiac disease running in the family, but as it's your aunt affected rather than a sibling or parent, you shouldn't be more at risk than anyone else. It's not an uncommon illness, though, and 1 out of 100 people will have it. We can easily test for celiac disease by doing a blood test, but as your symptoms may not be down to this, it's worth doing some other tests at the same time. Shall we check you are not anemic and that your thyroid gland in the neck is working okay? For 6 weeks before the test, you need to be eating your normal diet, including things with gluten in them, for the results to be reliable. If the test is positive, we'll refer you to a specialist at the hospital. So obviously when you refer, so the test we normally do is the anti-TTG, anti-transglutaminase antibodies, and for celiac disease. If that comes back positive, then we will need to very likely be referring the patient to the gastroenterologist, who might carry out maybe a biopsy, or at that point you might just make a diagnosis of celiac. Or if you want to, most times we need to confirm, so we need a jejunal or ileal biopsy to confirm celiac disease diagnosis. And then the treatment of celiac disease is avoidance of gluten-containing foods, just like every other allergy or hypersensitivity. Avoidance of the culprit, in this case gluten, is a treatment. The next Rcgp case card: explain a diagnosis of diverticular disease to a 75-year-old lady. Diverticulae are more common the older you get. 70% of 80-year-olds have them. Most people eating Western diets don't get enough fiber, so even if they aren't constipated, the bowel has to work hard in order to squeeze feces along it. Later in life, the walls of the bowel may develop weak points where the pressure builds up in the bowel. These weak areas can balloon out, making small pouches called diverticulae. Often, these cause no problems at all, but from time to time they may get inflamed, causing pain or even bleed. Sometimes they can even get infected, which will give you a temperature along with the pain and then require antibiotics. Aim for a high fiber diet, as these helps make larger and softer stools, which are easier for the bowel to push along. Aim to drink more than 2 liters a day to avoid constipation. If you get mild abdominal pain, taking paracetamol is a good idea. It is sensible to see a doctor if you have any change in your bowel habits or new symptoms, to make sure it isn't something more serious. The next Rcgp case card, this one says, discuss the likely diagnosis of gallstone in a 43-year-old obese woman. From what you've described, and now that I've examined you, I think you might have gallstones. It's interesting that your mother had her gallbladder out, because gallstones can run in families. Lots of people have gallstones but don't know it, because most of the time they cause no symptoms at all. When gallstones play up, they can do a couple of things. If they move about in the tubes connecting the gallbladder to the liver and bowels, they cause pain. This happens more if you eat fatty food. Stones can also cause irritation in and around the gallbladder. I can give you some information to tell you a bit more if you would like. First of all, we need to make sure it's the right diagnosis. An ultrasound scan of your tummy will confirm most gallstones, and a blood test will help us assess further. If the pain isn't controlled with simple painkillers, come back and see me. If you feel unwell, shivery, feverish, or turn yellow, you need to see someone urgently. Whatever happens, please please do come and see me again after the scan so that we can decide what next needs to be done. Of course, in this kind of situation, you also need to mention that having a high BMI puts one at higher risk of developing gallstones. So you have to encourage weight management and of other lifestyle habits like smoking cessation, cutting down on alcohol, and things like that. And the last case card for this session says, explain to a 21-year-old girl with one regular partner for 2 years and symptoms of genital herpes where she may have got it from. Infection like herpes is not a straightforward thing. Many people, 4 in 5, infected with the virus never get symptoms. It's caused by the same type of virus that causes cold sores and is passed on from skin to skin contact, especially moist skin like the mouth or genitals. Similar to chickenpox, the virus stays in your body by hiding in nerves. It doesn't cause any problems there, but can from time to time travel down the nerves to the genitals and cause sores like those you have at the moment. These aren't usually as painful as they were first time around and can come on with stress. People who have been infected with the virus are still carriers, which means they can pass it on to others even when they have no symptoms. The people they pass it on to may or may not go on to develop symptoms. We don't know why some people develop symptoms and others don't. We do know that some people can be infected and not develop symptoms until many years later. Therefore, it is not really possible to say where and when you got your infection, and you certainly shouldn't assume that your partner has been unfaithful, because this can be a really tricky question or something really tricky for a patient and can even lead to relationship breakdown. So you've got a new partner, and maybe 2 weeks, 3 weeks, a month into the relationship, you have genital herpes, and it's only rational to think it's your new partner that has infected you with, the herpes simplex virus. But it might actually be that you were infected some months, some years ago, and you're just having your first manifestation. So it's very important to counsel patients on that. And obviously it's still possible that it's a new partner, so it's quite difficult. You need to make it clear that it's difficult for the patient to know exactly when they got the genital herpes infection. Cheers.